please subscribe to the Berkshire Heroes channel. Have you clicked that button yet? Pressed it? Thank you so much. Now on with the show. I'm Laura Blumenthal on the Berkshire Heroes podcast, and joining me today is Forozan Nusrat, a NHS nurse. Welcome, Forozan.
Hi, Laura. Thank you.
So you've been a nurse since 2016. So you've done nursing before and after COVID.
Mm-hmm.
You work in a hospital where you specialise in head and neck cancer. But you didn't always know you wanted to be a nurse because you did a criminology degree first. So tell me about your journey to becoming a nurse and what you really enjoy about it.
So I decided that I wanted to be a nurse actually during my first degree. And I think it was also fueled by, being in the middle of a recession. And there's a lot of uncertainty about young people in the future as well. And I had to, I wasn't entirely happy with my decision with my first degree. So I really had to sit and have a real discussion with myself about what I wanted to achieve in terms of my future and my future goals and what sort of career that I thought I would be the most valuable in. And nursing was the obvious choice for me. It encompassed everything that I thought was valuable in my life. So a job that has longevity, a job where there are multiple avenues, different specialties, different areas of development for me. A job where these skills were transferable. I could go anywhere in the world. There was freedom in that. As someone who comes from a big family, and many people in my family do come from the nursing or medical background, that was definitely a motivation for me as well. I'd heard all their stories and just how much, despite its challenges, how much joy it also brought to their lives as well. And as a person, I love socializing. I love getting to know people. I'm a little nosy that way. I like to hear people's backstories. I like to know where they came from or what led them to make this decision or that decision. And I've always been a people person. And for me, just nursing was the obvious and inevitable decision. And I don't regret it. Yeah.
Do you have a particular patient or memory that you reflect on that you think, this is why I went into nursing, this is why I love it, that just really stays with you and makes you think, yeah, this is the career for me?
Many. There have been a lot of examples. I don't necessarily always remember every single patient's name, but I do remember every single one of their faces, and I do remember their stories and the impact it had on me and my colleagues as well. I remember their relatives. More specifically for me, it was the pandemic. I think it was unlike anything that my colleagues and I had ever experienced. I've been qualified now for nearly 10 years, and it really was so exhausting and heartbreaking. It really stripped everything back to the basics of human care. And what we found was that for these patients, it wasn't just an everyday routine for us. It wasn't our everyday routine. It was our everyday job. We really were having to employ different parts to our jobs. We weren't just nurses. We were sometimes these people, these individuals, their entire support system. We were their family in many cases, and we were sometimes, unfortunately, in some cases, the final person they saw. And for me, it just, whilst I'll never forget it, I can appreciate what it instilled in all of us and my colleagues. There was a real sense of solidarity and camaraderie, and really proudly a sense of that when it comes to it, we're all just really resilient, and we can work together to really actually achieve and manage the unexpected.
It must have been such a tough time. So thank you for all your hard work during that time. And obviously now as well, because you've got all the huge waiting lists to deal with. So is it more difficult now being a nurse after COVID than before? What are the new challenges you're having to deal with?
Well, you've already touched upon it. Waiting lists absolutely is. If I speak to anyone within my hospital, through to doctors, nurses, allied healthcares, admin staff, reception staff, everybody will say the exact same thing. It's the waiting list. And post-COVID, everything from routine scans to procedures, people that were already waiting several months, if not years, for certain appointments or for referrals to go through, we're now having to wait even longer. And unfortunately, there was the inevitable of people being lost in a system that was already having to deal with this such unusual circumstances. And I think what happened there was it created this immense pressure, not just on the system, but on the people having to uphold the system. And you know, the upkeep of that was, certain things had to take other priority. And it just, in many cases, I'm sure for people, it became unmanageable. So for me, that was, I would say post-COVID, that's, you know, that's the most noticeable. I mean, there's always been immense strain on the NHS, but I think post-COVID, amongst everyone I've discussed or spoken to about this at length, the waiting list is most noticeable, and you know, and also dealing with workforce shortages as well. Many members of my team had to, because they were considered very vulnerable. They passed the isolation period where they no longer were required to isolate for their own good, and they were allowed to come back to work. Some remained off work, and others have had to alter their working hours and their shift patterns. And many people, not just colleagues but patients as well, dealing with the after effects of COVID, the after effects of long COVID, and dealing with patients with increased complex needs. So those are the most noticeable ones. I'd say post-COVID has definitely, those are those three most significant challenges.
And how would you say morale is like in your hospital right now? Is there a lot of support and a lot of humour? And you talk about camaraderie, but are people perhaps saying, I might go and work abroad, I think that might be the right choice for me?
Both of those. So the division, I used to work on the wards pre-COVID and straight after COVID. I now work in a head and neck cancer department. So I work as part of their cancer service, which is predominantly 9 to 5, Monday to Friday. So for us, it's slightly different in that I work with a much smaller team, and I'm very, very fortunate to work with an incredibly talented group of people who are very supportive, who really promote boundaries.
So what more support do you think nurses need to be able to do their job better? Obviously, the gift of time is something everyone wants, but what is it that can be done to really help nurses go to the next level and be happier in their work, also do better for patients?
Over the last 10 years that I've been doing this, and I've discussed this on numerous occasions with, my doctor colleagues, nurses, allied healthcares, time and better staffing levels are the two most common answers. And for me, from my own experiences as well, it's not enough to just survive every shift and to survive every day, to run on adrenaline and short staffage and you haven't gone to the bathroom in 12 hours, you haven't eaten, you're incredibly stressed, you don't feel like you're well supported, you don't feel like you've got the time to ask your colleagues, can I just run this by you, because you're looking after XYZ patients, because you're also conscious that your colleagues and your managers also have their own set of work and their own challenges to deal with, so you just get by. That is not sustainable. That's what leads to burnout. That's what leads to mistakes. When there's a breakdown in communication, there's a breakdown in morale. There's just not enough time. But in order for us to have that, to really appreciate that, we need better staffing. We need safer staffing levels. We need more people on the ground. And it's not just about morale for staff, it's about better outcomes for patients, it's for patient safety. I don't see how anyone could argue that having safer staffing levels wouldn't automatically equal better outcomes for patients. Less chances for mistake, there's increase in communication, there's increase in staff morale. I mean, what are we doing for people's mental health? What are we doing for staff retention? There's no way that it wouldn't automatically improve all of those things. For me, those two are absolutely, it sounds very, very simple, but they're absolutely fundamental. And I think when you have safer staffing levels and you've got a team of people, doctors, nurses, allied healthcare, if you are well supported, you will naturally have the time to sit with your patients, to really understand their causes and concerns, to really observe their medical charts, to really observe their medical history, to observe their signs and symptoms, to really recognize when someone's deteriorating and have the time to appropriately escalate that to somebody else. And that is imperative. Until we have that, and we have that consistently, outcomes may be
It's not going to be good for staff. It's not going to be good for patients. No. I do worry about the vicious cycle that's been talked about recently of newly qualified nurses coming out of education, really keen, raring to go, want to get a placement, and they can't all get a placement. They're fully qualified, they passed
Mm,
everything, but there just isn't enough places for them, which I think to a lay person like me who's not involved in the NHS just sounds bonkers, because you need these people there to help you. But at the same time, I do appreciate that they do need to be trained and they are new, so they do need to be looked over and made sure that they're okay in doing things. So you need the staff. We want more fresh faces coming into nursing and feeling happy and
mm,
being there. But at the same time, if there isn't the time to support them, then you've got that vicious cycle of you can't get these people in at all, which is
mm,
awful. So there seem to be some serious problems. I think everyone's in agreement that would love more staff, but there are just some pockets of areas where it's just falling down, and that's not up to frontline staff to deal with.
mm,
That's up to others to try to work out how we're going to fix these problems, because there's
mm,
instances of newly qualified nurses having to volunteer in clinics because they just
mm,
can't get a role, and they're up
mm,
for going wherever in the UK,
mm,
but there just
mm,
isn't enough placements for the amount of people who graduate, which
mm,
seems like a scandal. And
mm.
I remember how happy you were when you got your first ever proper job as a nurse, and how exciting that is, and you just
Yeah.
graduated and your career was
Mm.
going, and it must be so heartbreaking for those young people to come out and the opportunity is not there, even though they hear all the time the NHS is understaffed. It's just really upsetting for
Mm-hmm.
probably people like yourself who need that help and want those young people, but
Yeah.
also those who just can't get in there. So there is a bigger problem, and I'm not quite sure anyone's really been able to solve it. But there does need to be some smart minds on it to really get to the bottom.
But I also think you're absolutely correct, Laura. But I also think we're doing those young people a disservice when we're bringing them into this system when we don't have adequate members of staff to train them, who've got the time to spend with them. And if we don't have the time to spend with them, do we have the time for our patients? So for me,
Absolutely, if you're rushed off your feet.
absolutely. And if we're not there to train them and and they're there and what I love about nursing and what I really always say to people that want to get into nursing, I'm like, if you are driven by care and advocacy and making a difference wherever it is, nursing is the avenue for that. But I just feel that increasingly people are being that they're terrified. They can hear on the news and from their colleagues and family members that people are struggling with staffing levels, and unfortunately it just doesn't seem attractive for people to come into a system where they don't feel like people have the time to train them, and to be left in a situation or a scenario, a hospital very unfamiliar with the machines and the beeping and the coughing and the sick and everyone's unwell, to be left in a scenario where you are vulnerable, it's terrifying for people. um, and the reason why I came into it is because I thought I'm going to be working alongside the best. And I have been very lucky to work alongside the best throughout my career, not just nurses, but, allied healthcares and doctors and surgeons and radiologists, anything. I've always had that privilege of working alongside wonderful people that really fed that passion and really fed that hunger to, right, they've instilled this in me. Now I'm going to go away and do my homework and come back and see what tomorrow brings. And that's what makes you better clinicians. It's what makes you better nurses. Now, if you're coming to a system where nobody's got the time to do that.
I do believe
Yeah.
in pinching good ideas from abroad. So, although
Mm,
I'm sure there are many countries similar to Britain who would also say the same thing about you just don't have enough staff, there are also probably some countries doing a really good job, and actually they are
mm-hmm,
getting those newly qualified people in, and
mm-hmm,
they're taking people from abroad as well. That's always going to be the case, but not maybe at the same level, which I think
mm-hmm.
raises the moral question of taking doctors and nurses from developing countries, which desperately need them as well.
Yeah.
So there's lots of things playing into it.
Mm-hmm.
But it'll be great to hear right now in your current role, what is it that you're focusing on, and what are you really enjoying, or what's stressing you out?
So I work for the head and neck cancer division at a lovely teaching hospital, a big teaching hospital, and we work with patients of various ages, various demographics, who are have been diagnosed and dealing with all forms of benign and malignant head and neck cancers. So I work with a fabulous team, an incredibly talented, very well supported team of people. And my role, a core part of my role is working with patients and their families at the point of diagnosis, and getting them through our pre-assessment process as soon as possible, particularly those that are undergoing big reconstructive procedures. And I think the the average person's understanding would be, you have a diagnosis, you have an operation. And whilst that is the case, there's a bit in between, and that's where I come in. So unfortunately, not every patient is fit to just go for a procedure. Many patients, especially as we talked about post-COVID, have got various complexities, various comorbidities, many of which have been unfortunately amplified as a result of waiting lists and things like that. And my job alongside my team is to assess their fitness, assess their health, as well as working alongside a fabulous multidisciplinary team of anaesthetic doctors and pre-op medical teams, to really optimize these patients as safely as possible. And I think when it comes to big surgeries, there really has to be a humane approach as well, versus this is something that you require, but what are your needs? What are your thoughts? What are your feelings? What is your understanding of this, and how does this fit into your life religiously, culturally, your own beliefs? Is this something that you even want? Versus if somebody is not fit. In many of our patients, we've determined actually, given the risks associated with certain procedures and the impact that general anaesthetic and the overall rehabilitation, the length of time, the recovery and rehabilitation that's required for major reconstructive head and neck surgery, sometimes it's come to the conclusion that it wouldn't positively impact an individual's quality of life. And actually, in some cases, it may potentially afford them less time with their family. So having really delicate conversations. But every step throughout the process, alongside my surgical team, my medical team, my anaesthetics, my wonderful clinical nurse specialist colleagues, having a really frank discussion with patients and their relatives, and really helping them to understand what options are available and why XYZ may be best, versus how does that work with them, and what are their decisions and their thoughts. So it comes with many challenges, but I thoroughly enjoy it, and I also have the luxury to enjoy it because I work with such great people, who really give me the time to ask questions and to develop and to ask what I call silly questions, and to work with people from all walks of life, with very colourful personalities. And that's not just my colleagues, it's the patients that I meet. It really is such a joy. So the joys outweigh any of the challenges, for me at least.
And if you could go back to Forozan the nurse in 2016 and tell her something that you've now learned almost 10 years on, what would you tell her? Would you encourage her to ask more of those silly questions? Would you tell her to relax a bit more? What do you think would really help?
I would tell her all of those things, plus more. I think several things I would tell her. I would tell her it's okay to not know the answer. It's not only is it okay for you to ask questions, it's imperative that you ask questions. And go away and do your homework. And there's a great freedom in taking some of your learning into your own hands and coming back and applying it to work and actually feeding off the people around you. But most importantly, I would tell her to calm down. I tell her to calm down, to relax. Just don't let your perceptions of things run away with you. It's never going to be as bad as you think. And if you think you're doing a bad job, I guarantee you everybody in this building thinks at one point or another, or even to this day, still think they're doing a bad job. So you're not experiencing anything that nobody else has experienced. And I would tell her to calm down because I was a little frantic back in the day. Maybe it was the excitement. Maybe that got away with me as well. Who knows?
You're enthusiastic.
Yeah.
And how do you keep yourself sort of calm and centered? Because most people have jobs where they get stressed, but they're like, it's not life or death. Come on, it's fine. It doesn't matter. Whereas your job actually is life and death. How do you make sure that you don't sort of start reeling from things or second guessing yourself or making mistakes because you are so worried?
Mm-hmm. Again, I work with an incredible support. Not only do I have a great support system at home, I have a really incredible support system at work. I have people that are willing who really encourage honesty, transparency, discussing, concerns or questions or anything, and actually who are honest and constructive with you about where they think developmentally you could do better.
So is there a really good culture of giving feedback in a very respectful way in the NHS so people can always improve and there is a culture that people want to?
I won't speak for everybody, but I will speak from my experience now. Where I work now is the healthiest place I've ever worked. It's the most supportive place I've ever worked. And it is the most constructive place I've worked. But constructive feedback with, with compassion and tact. And I think we should apply that to absolutely everybody, because we're all human and every single person is fallible. And I take that advice with me that I received at the beginning of my career. And I love that I work in a place that employs that thinking every single day. And it's an advice I'd give to people every day now.
If you were Prime Minister, what would you change about the UK and why?
For me, safe staffing levels, as I've mentioned throughout this interview, is absolutely key. I would make that a legal requirement within the NHS. And I think when we really think about investing in the NHS and, improving outcomes for patients and better quality of care and increasing morale in the staff, it all starts with safe staffing levels. And I think you can't invest in the NHS without investing in the people that uphold it. And if the people that are upholding it feel that their development is not important and that their pay doesn't match or reflect the responsibilities that they have on them, I know junior doctor colleagues that work several hours overtime every week because that's just required of them. That's the pressure of the system. For me, again, I don't know how people would think that would be how easy that would be to implement or where that, but safe staffing levels would be absolutely key. Like I would make that a legal requirement, and everything else would follow. You'd have better outcomes. You'd have staff that aren't just firefighting. And I always say this when I discuss this with my colleagues, it's not enough just to survive every day. We have to make the system enjoyable to a degree. It's not sustainable otherwise. When you have safer staffer levels, you've got people that are just, communication improves, staff retention improves, staff morale improves, outcomes for patients improve. For me, it's a very easy one.
Would that perhaps threaten nurses' right to strike if they weren't allowed to because legally there weren't enough people on a particular ward at a time? Would that be a worry, or are you more focused on nurses need to have better pay, better work conditions, better development to make sure that they are retained, because that's a key issue as well as recruiting them?
Yeah, I mean, so if you ask nurses up and down, there are several things that would improve that for them. Staffing levels. For me, from my experiences, from the discussions I've had with people over 10 years, the lack of support on the ground and the lack of staff on the ground, the unsafe staffing levels is as well as pay, are two very, very concerning factors. If I were Prime Minister, I would change them all. You ask a good question. Would that change nurses' right to strike? And in all honesty, I'm not entirely sure how to answer that.
I think an issue which people outside the NHS think about is, although there has been particular funding injections, so there was an injection of 36 billion in 2021 over 3 years. And considering the NHS's budget was 188 billion in 23-24, that's quite a significant injection. But it doesn't seem as if staff see it, they don't feel it, the patients don't seem to experience it. And of course, a lot will have gone on equipment and diagnostic centres, which won't perhaps be attached to your hospital. But there does seem to be a lack of transparency as to where this money goes to and how it's actually making a real world impact to retention of staff, their mental health, their job satisfaction, but also health outcomes to patients. Do you feel like there's a real gap in the knowledge for staff as well, that they would really want to know these injections come and go, but you just don't get to see it?
Yeah, I think, absolutely. I think, speaking on behalf of myself and anyone I've had a discussion with, that is something that we would that we're intrigued by, absolutely. But also at the moment, the general feeling is everyone's just trying to survive. who's got the time to inquire, and where do you go without upsetting people by asking those questions? Who do you go to? And there's a question, some people may question, am I even going to get the answer? Am I going to get a transparent and candid answer? Is another concern others may have. But of course, if that's information that we were all able to access, we absolutely would. Yeah.
I think that would help everyone, as well as a real focus on how can we make sure that staff are recruited at the right levels and also retained. I know that the government is working on that, and they are publishing some plans on that. So hopefully that will be comprehensive, but we'll see. But my last question to you is, obviously one of the key pressures on the NHS is we've got an aging population, and that's only going to get worse. And you can't stop people aging. But we are also one of the fattest nations, some of the most inactive populations. And I mean, I like a snack myself, and I don't always love going to the gym, so I get it. Is there more that we need to be doing as personal responsibility for ourselves to kind of take the pressure off the NHS where you can help it?
Yeah, I mean, absolutely. I think there's always a little bit of personal responsibility that could be taken. But for me, the angle I come from is obviously where I work in the division of head and neck cancer. Unfortunately, I work with people who don't get a say often don't get a say in why they have the diseases that they have. A lot of them, it's just very unfortunate. So, for example, certain risk factors associated to head and neck cancer, things like smoking, drinking, HPV, and many of these patients will say, I've never smoked or drank in my life. So in many of these cases, it's very unfortunate. However, what we do is with our patients who who have certain comorbidities, in terms of weight, BMI, blood pressure, or those that do smoke, we do encourage, or rather we advocate for, would you like me to refer you to this service? We've got a lovely prehabilitation service that we refer our patients to that require some help with exercise tolerance and advice. That's something we do. We've got a lovely physiotherapy department that we can refer people to. We've got a lovely smoking cessation team that we can refer people to. So the support is always there, but I think a lot of people are also very conscious of, especially in my division, in light of the unfortunate news people have received, not wanting to sound like you as though you're being critical or judgmental or adding on another layer of stress to somebody who's already dealing with a tremendous amount of stress. And of course there are delicate ways to do it. But what my colleagues and I try and practice is actually in promoting these healthy lifestyles and helping patients to understand. It really instills a sense of the sense of autonomy, of having some control over your life where everything else has been out of control. It can be empowering. And some people will take the advice and some people do not. And it's really just respecting their wishes, but actually just knowing that as long as we have done our due diligence and able to relay the advice sensitively and with compassion, then we've done our best.
Thank you so much, Forozan Nusrat, for joining me on the Berkshire Heroes podcast. It's been a pleasure to talk with you.
Thank you so much for having me, Laura. Thank you for your time.
And please remember to subscribe to the Berkshire Heroes channel.